Welcome everyone to IsisParenting's Breastfeeding webinar and chat. My name is Nancy Holtzman. I'm here at IsisParenting outside of Boston, Massachusetts, and today we're going to speak about gas, spit up, and reflux, a popular topic for new moms. A lot of questions about what's normal, what's too much. And of course, today we have great photos submitted by some of our followers on Twitter. So I always appreciate when people send pictures in on our call for photos. Today we have Liz in our moderation role in the chit chat room. So thank you, Liz, who's the mom of an active toddler with another baby on the way, who probably has mopped up her fair share and then some of spit up. I myself am the mother of two kids who are now older teenagers, and both of them, well, I think maybe my son had reflux. So I mentioned the other day on Twitter that if you have a baby who is a big spitter, someday the smell of sour milk on your shoulder will make you nostalgic when your child is older and grown and no longer spits up down your shoulder and all the way down your back. Someday you'll hold some other baby and you'll smell that faintly curdled soured milk smell, and it will bring you back to the days of cuddling your barfy baby. That's what we're going to talk about. So, why are babies so dramatic about their digestion? I do commonly tell a story about young babies being dramatic about their digestive system. There's a lot of grunting and straining and arching, turning beet red, straining, a lot of 4 a.m. type noises. They will work very, very hard and then pass a little gas or have a bowel movement, and it's a very obvious process for the youngest of babies. Let's think a little bit about the newborn's experience. What is and isn't practiced in utero? In utero, your baby is floating in amniotic fluid, and they're actually practicing quite a few things there. They practice breathing, so they actually breathe in and out amniotic fluid, and that is to get their lungs and their chest wall muscles strong enough to practice breathing in utero, so that when they are born, those muscles have been exercised and they're able to breathe the room air. So they practice breathing. They also practice sucking. They do a lot of sucking in utero. They suck their hands, they suck their feet, they suck their umbilical cord, anything that's near their mouth, and because they're scrunched up in such a tight package, there's various body parts and umbilical cord pieces to suck. They practice swallowing. So they suck and they swallow amniotic fluid, and that goes in their stomach, and it gets absorbed by their system, and then they pee it out. They urinate in utero, and urine in utero turns into amniotic fluid. So amniotic fluid is the equivalent. It's the same thing as baby pee. They just recycle it, they drink it, they absorb it, they pee it out, and they drink it some more. That's why I always tell moms not to worry if their baby pees in the bathtub. Urine is sterile, baby pee is sterile, and in fact, in utero, your babies drink it quite a bit. One thing they don't do in utero is practice digesting anything, and they don't have any experience with gastric motility, with peristalsis, with having a bowel movement, and in fact, all of the stuff that does get absorbed gets built up and sits in their lower colon, and that's what meconium is. Meconium is the baby's first bowel movement. It's made up of various substances and dead blood cells and so on, and it turns into like a plug, kind of a thick, tarry black mass. It just sits there until hopefully they're born. They start drinking colostrum, which has a great laxative effect, and then they poop out that meconium during the first 24 to 48 hours. So they have no experience with digestion and with bowel movement and passing gas in utero. They don't pass gas in utero. They have a plug in their butt. That's meconium. Young babies do three things. Those of you who hang out with me have heard me say this many times. Young babies do three things. They eat, they sleep, and they fuss. I say this with love, that I'm a newborn person, but really, these are the three things that the very youngest of babies do. They eat, they sleep, and they fuss. If they're not eating or sleeping, chances are you're actively involved in keeping them happy, and that usually involves moving them, walking, bouncing, swaying, and of course, almost all of these things involve your body, because eating, they're in your arms, they're at your breast, Sleeping, they are in your arms and at your breast. They are not sleeping happily in the white eyelet bassinet that you so carefully selected. And fussing, you are actively involved in trying to keep them happy. The hardest weeks, in my opinion, are weeks 4 to 8, somewhere in that range. And that's because young newborns tend to sleep a lot. You may be able to swaddle them, put them down. They may sleep for an hour or two down. They're so cuddly. You love to hold them. Usually there's a lot of social supports. Partner is home and not at work. Family members, people from work are stopping by. Around week 4 and 5, what happens is everybody else's life goes back to normal, but the mom's life has forever changed, and the newborn begins to wake up. So they're spending more and more time awake at 4 and 5 and 6 weeks, and when they are awake, they're not particularly happy. Let's go back to those 3 things. They eat, they sleep, and they fuss. So if you take away sleeping, it only leaves feeding and fussing. And so for the mom with a 5, 6, 7-week-old, if she feels like she is spending her entire day sitting on the couch nursing her baby or pacing the living room to try to keep her baby from crying, she is probably absolutely correct. That is how you spend the majority of your time with a baby in that age group. The hardest weeks, in my opinion, 3 to 7 or 4 to 8, something in that range. And in my opinion, when babies are fussy, it often gets translated into gas because they make these gassy noises. They strain, they grunt, they turn red. When they're passing gas, when they're having a bowel movement, it's very obvious and they are distressed. Let's review a little bit of digestion here. Let's see, it's hard for me to breathe and talk and do things all at the same time. So here I've actually got my pointer. Did I? I see it up in the top there, but I can't grab it. Oh, I wanted to have a pointer for this. Let's see, hold on. There we go. No, it's gone. There. Okay, so here is the bébé. And in my warped sense of humor and the way my brain works, I just like various pictures and analogies. So here's some interesting data points that you may not know about. Here's your baby's intestines. And did you know that a newborn has about 10 feet worth of intestines coiled up in there? And at about a year old, it's probably about 15 feet worth of intestine coiled up in there. And it's not all big, ropey, thick intestine. A lot of it is this stuff in here. The small intestine may only be the diameter of a straw or a pencil. Then, the colon is where it gets pretty big. Why do I have a snake here? This is a reminder that your baby's digestive tract starts at the mouth. And the baby swallows milk and it goes into the stomach, and then again it's gonna pass along the intestine. It's gonna have various things happen to it as liquid gets absorbed and nutrients get absorbed, and then it builds up, and then it comes out the rectum. So just like the picture of the snake here, it is one very long interconnected interconnected tube of a coil of intestine, and it starts in one end, and inch by inch by inch, it just continues on until it is at the rectum. And the reason this is significant is because of what's called gastrocolic reflex. And this is not colic, and this is not reflux, which we'll be talking about shortly. The gastrocolic reflex, if you think back to your high school biology class, you remember the term peristalsis. And peristalsis means smooth muscular waves of contraction, starts at one end, and when the baby begins to drink, the milk is received into the stomach, and the stomach gets excited, and the stomach begins to contract, and it propels the milk down into the small intestine, and inch by inch by inch by inch by inch, these electrical impulses of contractions wake up the next inch of the intestine, and so on. And so you've got, again, remember, 15 feet from the beginning all the way down to the end of the GI tract getting excited when the baby begins to drink. And so that's why 5 to 10 minutes into a feeding session, it's very, very common for a very young baby, 2, 4, 6, 8 weeks old, to begin to grunt, strain, fuss, act like they're uncomfortable, act like they may be having gastric cramps, because guess what? They are. This is also exactly why babies have a bowel movement midway into their feeding. So you might joke and say, well, it's in one end and out the other. That is exactly what it is. The gastrocolic reflex starts at the mouth, and it excites inch by inch the entire GI tract, and that includes the sigmoid colon where the stool is sitting and ready to be exploded out. So gastrocolic reflex is something important to remember because this is why babies are uncomfortable during feeding, and it's not always related to acid reflux, although many parents worry that it is if they have read about acid reflux. Because the baby gets fussy when he's eating, they think, oh my gosh, it might be reflux, or it might be something in my diet. Maybe it has to do with that enchilada I had for dinner last night, or the fact that I had broccoli 2 days ago. Is that making my baby gassy, and so on. Just the very act of eating and digesting is enough to make your baby gassy. So the reason that new moms worry so much about the baby's gas is because it's so present and it's so dramatic. I have 2 quotes here that I use often. I usually say that the vast majority of new moms actually think that their baby is gassier than the average baby. So in a group of brand new moms and infants, when I ask that question, how many of you think your baby is gassy? Every hand goes up. How many of you think your baby is gassier than the average baby? I think they see where I'm getting, so they're a little embarrassed to put their hands up, but I think most moms secretly worry that their baby is gassier than average, and that they're in some sort of digestive distress, and does it have to do with something that mom is eating, or they're not burping the baby correctly, and so on. The reality is that newborns are just gassy little gas bags of gas, and they are very, very dramatic about it. So what do you do for this gas? Because babies really do get distressed. And some people will ask about Mylicon, which is a simethicone, and the intention of Mylicon is that it is supposed to use silicone beads to gather up little pockets of air or oxygen to make it easier for the baby to pass a burp or pass gas. Now, the evidence, the research on this shows that it helps about 30% of babies. And then other research shows that using a placebo also helps 30% of babies. And placebo, for those of you not familiar with that term, means a medication, a pretend medication. So in a double-blind study, we'll give in this case, some parents the actual medication, and then other parents will get an identical bottle with a solution in it, and so on. So just there's 2 things going on here. The very act of giving the baby something sometimes makes the parents feel like there will be a response, and it is a little bit helpful. There's also another situation, which is that anything slightly sweet actually makes babies happy. So sometimes people will ask me about the Highland teething tablets, and do those seem to help the baby? They're homeopathic tablets, and the reality for those is that they are the homeopathic ingredient is embedded in a lactose base. So they're tiny, tiny little tablets that contain milk sugar, and it's like putting a little drop of something sweet on the baby's tongue, and it dissolves there, and it makes the baby happy for a few minutes. So does it actually help their teething? Probably not. But does it make the baby stop crying for a minute or 2? Yes, it probably does. And same thing with the simethicone. So the research does not support it as being any more helpful than giving a placebo, but both giving placebo and giving simethicone do make the babies a little bit more comfortable than doing absolutely nothing. So take that as you will. Now, there's a lot of interesting preliminary research on the use of probiotics for babies with a variety of issues, including digestive upsets, the typical colic experience, babies that cry a lot, and so on. And we know that your immune system, an infant's immune system, is focused in their GI tract. A lot of parents don't actually know that, and that your GI tract is already colonized. It's sterile at birth, but it's colonized with bacteria, healthy bacteria, within hours and days after delivery. And you see some emerging research that talks about how babies that are born from a vaginal birth have different intestinal flora than babies that are born from a C-section. So there's a lot of interesting information emerging about the importance of certain healthy bacteria in the gut. And lactobacillus is is one particular type of probiotic that is very advantageous in terms of digestion and colic symptoms, things like that. People often ask me on Twitter, well, what probiotic do you recommend? And there's a few different brands out there, but really the important thing is that it's a high quality probiotic. The problem with probiotics is that it may contain, you know, X number million cells of the probiotic in it, but does it actually survive living on the shelf at Whole Foods? Then when you give it to the baby or you take it yourself, does it survive the acid in your stomach and actually get to the intestine where it's supposed to? So I'm not so knowledgeable about probiotics that I can recommend one brand over the other. I urge you to use caution when you're researching online, because